community in Bayelsa State has emerged as the epicenter of crude oil pollution in the Niger Delta. Emzor Pharmaceutical Industry Limited has restated its commitment to supporting malaria control and elimination efforts across Nigeria and Africa. Good day, viewers. Welcome to DDM Health News Updates. On our program, your health, your wealth. As usual, viewers, I often remind you guys to subscribe to our YouTube channel so that you get the latest updates in town. So, check out what we have today. Ikarama community in Bayelsa State has emerged as the epicenter of crude oil pollution in the Niger Delta. The community, nestled in Okordia Clan, Yenegoa local government area, is surrounded by oil facilities and shrouded in environmental despair. With a firm of oil coating Taylor Craig, residents say the number of spills is uncountable. So sad. President of the Federated Yenegoa Youths, Comrade Wade Benjamin, says the damage is worse than of Ogoniland. Whew. Media reports underplay our reality. Ikarama is the most polluted oil-producing community in Nigeria, he told Project Focus. Despite hosting major oil companies, Ikarama lacks a functional health center. So sad. Many residents have died from cancer, believed to be triggered by long-term exposure to oil pollution. 3 women recently died of cancer-related ailments. Among them was Mrs. Idutimi Dotimi, 47-year-old, who died of breast cancer in 2021. She was the family's breadwinner, running a small restaurant to fend for her husband and children. Her husband, Chief Dotimi Peter, said they exhausted all resources, medical and spiritual, before she passed. She died after all treatments failed. We even tried divine healing, but it was too late, he added. So sad. Dotimi's case highlighted the collapse of the public health system in oil-rich Bayelsa. People here don't announce sickness. Families quietly manage cases until it gets out of hand, Benjamin explained. In 2023, another woman, Smart Dotimiye, also died of breast cancer. Then in 2024, 22-year-old Danaki Rebecca died of bone cancer. The Bayelsa State and Environmental Commission has linked the cancer outbreak to crude oil pollution. Its 2019 report, Environmental Genocide, confirmed the health risks of Ikarama as severe and widespread. Dr. David Samuel, a medical practitioner, said crude oil contains cancer-causing chemicals like benzene. He warned that long-term exposure through air and water could trigger leukemia and other cancers. Workers in oil fields and residents near spill spots face serious health threats, he said. Director of Public Health in Bayelsa Ministry of Health, Dr. John Stewart, said scientific links now exist. There is correlation between prolonged oil exposure and certain cancers, he confirmed. Environmental activist Maurice Alago also recounted a decade oil deaths from cancer in Ikarama. The woman lived 5 meters from a spill site. Foams filled her house daily until she fell sick and died, he narrated. Alago, who visits spill sites frequently, said he now feels burning sensations in his leg. Oh God. It's possible from years of working in oil-polluted water, or don't you think so? Activist Eunice Nachi of Woman Network called for urgent community health awareness. Ikarama needs aggressive advocacy to curb rising cancer deaths, she said. So far, there has been no structural sensitization or intervention by either government or oil firms. Benjamin blames this on negligence from all quarters, including community leaders. We have had no cancer awareness program. People suffer in silence, he lamented. So sad. Residents say that they can't leave their ancestral land despite the pollution. This is our home. We won't become strangers elsewhere, one villager declared. Oh my goodness. There is no electricity, no clean water, and no mobile network in Ikarama. Healthcare is miles away in Yenegua or Okolobiri Teaching Hospital. People are really suffering. Most sick residents are only diagnosed when it's too late. By then, even divine help fails to save them. You can imagine such. For now, there are no known cancer patients alive in Ikarama, but residents fear many more may be undiagnosed. Health experts and environmentalists are calling for urgent coordinated response. Please, the government shall assist. The time to act is now. If not, we will lose many lives to silent killers. Oh, don't you think so? Please, the government should act very fast. Up next, health experts have warned that Nigeria risks reversing gains in malaria control due to dwindling international support. They said unless the federal government prioritizes local funding, the country may not meet the 2030 malaria elimination target. The experts spoke in separation interviews on social media twice during the 2025 World Malaria Day commemoration. This year's theme is Malaria Ends with Us. Reinvest, Reimagine, Reignite. Professor Olusegun Ademowo, a pharmacologist in the University of Ibadan, said Nigeria's malaria control efforts were yielding results due to combined local and global funding. He noted that malaria prevalence among under 5 children dropped from 42% in 2010 to 22% in 2021. But he warned that the achievement could be lost if government fails to provide adequate funding. Please, if government does nothing, the progress will be affected. So please, government should do something. Though we have made gains that can't be completely eroded, continuous support is vital. He called for increased public health education, drug subsidy, and strengthened research to measure malaria burden and intervention impact. Ademowo stressed the importance of educating Nigerians on the right treatment protocols. People now know the need of artemisinin-based drugs like Coartem, not chloroquine, he noted. He urged government to subsidize treatment, support research, and intensify community-based control strategies. Also speaking, Professor Chijioke Nwuche, a malaria researcher at the University of Port Harcourt, said malaria still poses a significant threat to national development. He said the disease affects economic productivity, child development, and maternal health. Nwuche decried the low attention given to malaria by policymakers. Malaria is treated as an afterthought, he lamented. He called for a national emergency declaration on malaria and increased investment in research and control. Furthermore, Nwuche urged State Fund to earmark at least 1/3 of its budget for malaria research and intervention. State Fund should create a special intervention fund for malaria, he said. According to him, researchers rely too much on international agencies whose funding often doesn't align with Nigerians' unique needs. Of course, he advocated for more local research, especially on malaria in children and pregnant women. Even without US aid support, we can do something substantial if we prioritize, Nwuche added. He called for better diagnostic tools in hospitals and renewed focus on preventive measures. These include use of insecticide-treated nets, indoor sprays, window nets, and sanitation. The researcher also called for improved collaboration among stakeholders in malaria fights. He said, States and local governments must take the lead in malaria control at the grassroots. Each local government area gets 2% direct funding. How much of it goes to malaria? He asked. He urged private sector support, saying malaria should no longer be left to government alone. Stakeholders should collaborate with them. Also, the World Health Organization says Nigeria bears the world's highest malaria burden. It accounts for 27% of global cases and 194,000 deaths annually. Gosh. WHO warned that over 30 malaria endemic countries are already facing service disruptions due to funding cuts. In 2023 alone, malaria killed nearly 600,000 people in Africa. Nigeria recorded 68 million malaria cases in the same year. Experts insist that only sustained political will and local funding can help Nigeria stay on track to end malaria. They called for urgent reinvestment in research, control, and prevention as foreign aid dries up. Please, we don't want to die of malaria. Or do you want to? Me, I don't. So, well, in continuation, as the world marks 2025 World Malaria Day, Nigerian pharmaceutical giant Emzor Pharmaceutical Industry Limited has restated its commitment to supporting malaria control and elimination efforts across Nigeria and Africa. The company pledged increased funding for malaria-related programs and research. Wonderful. Head of Marketing and Strategy at Emzor, Mr. Kunle Faloye, made this known in a statement made available on social media on Thursday, 24th of April, 2025. He said the company has remained consistent in producing essential anti-malaria drugs that are helping to reduce maternal and infant mortality. Wonderful. Faloye noted that this year's theme, Malaria Ends with Us, Reinvest, Reimagine, Reignite, aligns with Emzor's vision of improving lives and health outcomes. Emzor has been a strong player in malaria control. Our anti-malaria drugs are affordable and accessible to millions across Africa, he said. He added that the company's investment in research and distribution networks has contributed significantly to reducing malaria prevalence. We have stepped up our efforts to ensure Nigeria moves closer to becoming a malaria-free country. But is that possible? World Malaria Day, celebrated every year on April 25th, is used to drive attention to the global malaria burden. The day was set aside by the World Health Assembly in 2007 to call for more investment and stronger political will to combat the disease. This year's theme urges countries and stakeholders to reinvest in malaria control, reimagine strategies, and reignite commitments from global to local levels. Malaria is caused by the Plasmodium parasite, transmitted through the bites of infected female Anopheles mosquitoes. In Nigeria, malaria is endemic and spreads all year round, especially in rural areas. Of course, the disease remains a major public health threat in the country, with serious health and economic implications. Seriously, it bites a lot. According to the National Institute of Health, that is the NIH, Nigeria loses about 9.92 billion annually due to malaria-related costs. The WHO states that Nigeria records the highest number of malaria cases and deaths globally. In 2020 alone, Nigeria accounted for 27% of all malaria cases and 23% of global malaria deaths. As part of activities to mark the day, Emzor organized community outreach programs. These include a health walk, free medical screening, and distribution of anti-malaria drugs to vulnerable populations. Wonderful. Faloye expressed concern that malaria remains a top killer of pregnant women and children under 5 in Africa. He reaffirmed Emzor's commitment to reducing the burden of malaria, although sustained pharmaceutical efforts Our long-term strategy is centered on producing quality medicines that saves lives. Please keep it up. He further disclosed Emzor's multi-million-dollar investment in the production of active pharmaceutical ingredients, that is the API, in its Sagamu Pharmaceutical Campus, Ogun State. According to him, this investment will boost local capacity and ensure uninterrupted access to life-saving medications. Faloye called on governments, private sectors, and development partners to join hands in ending malaria. Malaria ends with us, with all of us in fact. So the time to act is now. Or don't you think so? I don't want mosquitoes to continue biting me. Well, viewers, here we come to the end of today's program on your health, your wealth. Please do ensure to click on the like button, share, subscribe to our YouTube channel, Diaspora Digital Media, for more health news updates, to get the latest and know how to follow your health, because your health is always your wealth. Well, thanks for watching. I remain Nenyo Michael Izumi. Until I come your way next time. Bye for now. You have a wonderful day ahead.